Hi, Mrs. Jones. My name is Julie. I'm going to be your nurse today. We're going to be doing a full head-to-toe assessment. I'm going to ask you some questions as well, okay? Okay, that sounds fine. So first, please tell me your name and your date of birth, where you are right now, and what year it is. My name is Kathy Jones. My birthday is 10/2/1975. I am currently at Tampa General Hospital and it is the year 2020. Okay, great, thank you. And what type of home do you have? A house with stairs, a condo, an apartment, and who do you live with? I live in a single family home. It has 2 stairs upon entrance and I live with my husband and 2 kids. Okay, what type of activities are you involved with? Do you work out at the gym? Do you volunteer at all? Do you work full-time or part-time? Yes, so I do yoga 2 times a week, and my husband and I try to walk 3 times a week, and I work 40 hours a week at a desk. Okay, so right now I'm checking your IV to make sure it's not red or swollen or painful. Do you have any pain around that area? Okay, so I need you to let me know if you do develop any pain around that area or any burning, stinging, if it starts to get red or swollen, or you see fluid come out of it or anything like that. Because then I will need to either change it or take a look at it, okay? Are you having any trouble breathing right now or any chest pain? Yes, it is a little bit difficult to take a full deep breath right now. I find myself short of breath, having trouble catching my breath, especially when I'm walking around and things like that. Okay, so one great way to help with shortness of breath and things like that is an intensive spirometer. It's a device that you can use, and you take a deep breath in and you see how far you can get the ball to move up in the device. I'll show you how to use it, and it's a great way to prevent pneumonia, and also it just promotes respiratory health. You didn't mention any chest pain, which is great, but I would like to encourage you to definitely report to us if you have any changes. Chest pain, pain in your arms, your back, sharp crushing pain, and if your breathing gets any worse. Have you had any nausea, vomiting, or diarrhea, or changes in your GI system? And when was your last bowel movement? No, I haven't had any diarrhea or nausea or vomiting or anything like that, and I used the bathroom this morning. Okay, wonderful, thank you. So I'm going to take a listen and a look and a feel to your abdomen. I'm going to listen for bowel sounds. If I don't hear any, then I will have to listen to each quadrant for 5 minutes and assess if there's a problem. And then when I palpate, please let me know if you feel any pain. Have you had any changes in urination? Are you peeing more frequently or less? Is there any burning or pain? And when did you last urinate? No, I feel that I've been using the restroom about the same. The last time I went pee was probably an hour ago. Okay, great. So while you're in the hospital, we are going to monitor your intake and your output, so any fluids or clear liquids that you ingest, and anytime you go to the restroom, you use the bedside commode so we can get an accurate measurement of your output. Do you have any swelling, numbness, tingling, pain, pins and needles in any of your extremities, your feet, or anything like that throughout the day? No, I don't have any pain or tingling or numbness in any of my extremities. Okay, so I'm going to assess bilateral strength in your feet and in your hands. So when I place my hands in yours, I want you to squeeze at the same time. And then when I place my hands on the bottoms of your feet, I want you to push against my hands as hard as you can, and then I'm going to switch, put them on top of your feet, and I want you to pull up against my hands against resistance. This is a great way to test and make sure that you are strong on both sides equally, to test for things like MS, stroke, etc. All right, our assessment is finished. Is there anything else I can do for you right now? No, I'm okay right now. I'll let you know if I need anything. Thank you.